most exciting thing that's happened recently is when we looked down the microscope and we could see some tissue from an injured spinal cord that actually looked like it was almost healthy tissue. That was just so exciting. Everyone was just running around the lab, and yeah, it was just an amazing feeling. So after spinal cord injury, you lose your connection between the brain and the body. So no signals are passing between the brain and the body, which means you can't then control your functions. If your injury is high, you might lose your arm function and your leg function. If your injury is lower, you may become paralyzed. So what we're trying to do is reconnect and repair some of these signals. And if you can get repair of just one or two segments of the spinal cord, that could have a huge effect on a patient's life. You may be able to get hand function back, which is very important for independence. Patients will then be able to wash and dress themselves and be independent. For a lower level injury, we're aiming to get ideally recovery of motor movement and be able to walk again, but other functions that are very important to spinal injury patients are to try and get control of their bladder and bowel function back. If you have a cut or an injury in your skin, a scar will form and that will heal over, and that will get fixed and cured. If that happens in the spinal cord, the scar remains there and nothing can grow through it. So no new nerve fibres can grow through this thick, but it's like a block to repair. So what we try and do is break down the scar tissue and make the tissue more what we call growth permissive. So it allows things to grow through this kind of wall or this barrier to repair. So at the moment we've had a really exciting breakthrough using our gene therapy approach, which breaks down scar tissue in the spinal cord. And you can see here that normally after an injury you get these huge holes in the spinal cord, and in red here you can see this thick scar. What we found with our gene therapy is that you can repair much of this damage, and this has shown some really exciting effects in our animal models. We've got regain of hand function and some regain of limb function, and there's also been some regain of bladder function. All these are very, very important for spinal injured patients and really important goals in our research. Because these results have been so effective, we've never seen anything work like this as well as this in the spinal cord. The next stage is to try and translate this now forward to the clinic, which means we need to try and do some safety and efficacy studies and eventually move forward to clinical trials. So I think it's a really exciting time for spinal research, and therapies such as the one we're working on and other therapies being worked on in other labs around the world are now coming to the stage that they really are being pushed forward to the clinic, and we maybe even combine some of these therapies together to get an ideal therapy for spinal injured patients. And I really think within the next 5 or 10 years we're going to get these therapies to the clinics, and patients are going to get some function back of their hands and of their legs.